Hi, it's Dr. Tipton. I'm just here with another update about Blossom Health, the direct primary care clinic opening in West Jordan soon. And I know what you're thinking. You're thinking maybe I can't afford this. I just don't understand why I have to pay every month when I might not see a doctor every month. And maybe you are happy with your insurance-based doctor, and I am super glad if you are. I totally understand. You should do whatever is best for your situation. And I appreciate you sticking with me this far to learn a little bit more about direct primary care. It might work for you in the future or someone that you love, so just consider sticking with me. I will only send one monthly newsletter so you can stay tuned with what's happening with Blossom Health and find out what we have in store for all of our patients. But for those of you who are just thinking, she might be onto something here. I might just want to dig in a little bit further and see if I want to join this direct primary care clinic and see what's different about it. I'm so glad you decided to stick with me. So new members do have to sign up for an initial 3-month period. After that, it's just a monthly fee. And that is approximately the cost of a mobile phone bill. It's deducted automatically from your bank account on the first of every month. And that way you just know that you are covered. When you get that sickness, when your kid falls down, you suddenly need care, you're covered at Blossom Health. And you can just call or come in and get what you need. Let me just go over what is included in the membership. So all office visits are included. That could be in person, that could be virtual, even a telephone call. Even after hours access is included. These will be mostly urgent needs, but when there's access during the day, regular business hours, there's just not as much that you're gonna need after hours unless it's truly urgent. All in-house procedures and basic diagnostic testing is included. There are some additional services that are not included in the membership, and those are gonna be at significantly discounted rates. So these are things like labs and imaging, and you could pay for those with cash or you could use your insurance for these type of services. I'd like to go over the many perks of direct primary care. There's a lot. You get to see your personal doctor every time. You have that consistency. Again, you have after hours access with that same person because sometimes you just really need to text a rash to your doctor so that you can figure out what that is right then and not have to have a whole visit a week later for that. And maybe you just want to ask me, should I really go to the ER because my son fell down and hurt his toe and it might be broken? We have transparent upfront pricing. So if you need a complete blood count, I will just tell you, hey, that's $12. You can just pay before you go. And you could also bill it to your insurance. So there's no copays when you come in. There's no long check-in lines, checking your eligibility for your insurance, no surprise bills after the visits, which is lovely. And one thing I am so excited about, no more 10 to 15-minute visits, because I don't like them and nobody does. Think like a 30 to 60-minute time frame. And I will not have another inane conversation that makes me so crazy about how you have to separate your wellness from your sick visits like we do with the insurance model. Novel concept, I can just take care of what the patient needs that day. I also will be offering in-house procedures, something really weird in the insurance system. If you just get a skin tag cut off or a wart burned off, all of a sudden you've got a $300 fee and that all goes to deductible. So in direct primary care, that is not the case. You got a skin tag, let's do it. You don't have to come back on a separate day of service. And if you just need a short appointment or like it's just too much to cover and you don't want that 60-minute appointment, no problem. We'll just have you come back for another appointment in a few days, maybe next week. Because when I don't have thousands of patients, I could actually have access the next week instead of, your next appointment's 2 months, so you gotta cram it all in today. I will only be taking a limited number of patients on my panel for Blossom Health, and that will ensure that I have adequate time and that you have adequate access. In Blossom Health, your doctor works for you. Your doctor does not work for the insurance company. So this allows me to put your needs first and provide convenient, expert, and comprehensive care when and where you need it. I am so excited to open this practice that I can hardly wait. Please watch here for additional information. We'll be sending out monthly newsletters. You can also look at my website at www.blossomdpc.com and find most of your answers there. There's also a link in this email.